If you're searching for a foot and ankle specialist near South Orange County right now, you're probably in pain. You've tried a few things, they haven't worked, and you need to know who to trust before you waste another appointment. This video answers exactly that. Most people assume that if someone has a medical degree and treats feet, they're a foot and ankle specialist. A podiatrist is a podiatrist. The letters after their names are formalities. That assumption collapses when you understand the certification process actually is. The designation, fellowship, foot and ankle surgeon, isn't automatic. It requires fellowship-level training in the foot and ankle, a surgical caseload, a formal board examination. Not every podiatrist holds it. Not every foot doctor near you has completed that level of surgical training. If you're dealing with a bunion that's progressed, a reconstructive issue, a complex ankle instability, a provider's surgical training is directly relevant to the options they can offer. A generalist may have one or two approaches. A trained surgeon that has access to the full range, including minimal invasive techniques, a less specialized provider may not be trained to perform. If you're searching for a podiatrist in South Orange County or a foot surgeon in Orange County, the first question to ask is simple. Are you board certified in foot and ankle surgery? That one question separates the field immediately. If the answer is yes, you're talking to someone whose training was dedicated to the specialty. If the answer is unclear, that's information too. Once you've confirmed certification, the next question is how they operate and what your recovery is going to look like. People assume surgery means long recovery, cast, crutches, weeks off your feet. That's the picture that most patients expect. And most providers don't challenge it because that's how they were trained. Surgical techniques have advanced significantly. Minimal invasive procedures for bunions, hammer toes, certain ankle repairs now allow many patients to bear weight and walk the same day. Not every foot doctor in Mission Viejo or podiatrist in Orange County have adopted these methods. Some are still using a protocol that's decades behind. If you're a working parent, an athlete, or someone who can't afford 8 weeks on crutches, the difference between a surgeon who offers same-day weight bearing and one who offers full immobilization isn't a minor inconvenience. It can be the difference between having the surgery and deciding you simply can't afford the downtime. Ask any foot and ankle specialist you're considering this direct. Do you offer minimal invasive surgical options? And what does your recovery look like for my specific condition? A surgeon with current techniques can walk you through the approach and realistic expectations. At Podiatry Hotline Foot and Ankle, Dr. Rumbacher uses 5 to 10 different approaches depending on the patient because patient-specific planning is what determines outcome. If this breakdown is useful for you, subscribe to this channel. There's a full library of videos built specifically for people in South Orange County who want to make informed decisions before they book. Most people research passively. They read a few reviews and they check a website. That process doesn't surface the information that actually predicts whether a specialist is right for your case. This one does. Search foot and ankle specialist in South Orange County or podiatrist South Orange County and pull up 3 names in your area. Mission Viejo, Laguna Niguel, Laguna Hills, Aliso Viejo, Dana Point, San Juan Capistrano. For each provider, confirm whether they hold board certification. That information is publicly verified through a website. If a provider does not appear there, note it. Check each practice's website for language about minimal invasive surgery and same-day weight bearing. If neither of these phrases appear, ask about it directly when you call. Call the office and ask one question. Can I reach the doctor directly between appointments? At Podiatry Hotline Foot and Ankle, Dr. Rumbacher gives every patient his personal cell phone number and stays in the exam room until every question is answered. That level of access is not standard, and it signals how the entire practice relationship works, not just the appointment itself. If you are in South Orange County and want to meet a provider who meets all 3 criteria, board certified, trained, minimal invasive surgical options, direct access between appointment, call Podiatry Hotline Foot and Ankle and request a consult with Dr. Rumbacher. 3 questions. Board certification in foot and ankle specifically. Current surgical techniques with realistic recovery expectations. Direct access when you have questions between appointments. These 3 criteria give you a real standard to evaluate the foot and ankle specialist near South Orange County. Not just a star rating and a website photo. If you want to go one level deeper, the next video covers exactly what to look for before you book a podiatrist in South Orange County, including the specific red flags that show up in an initial consult and how to read them. This video is ready for you right now. Watch it next.